We are a nonprofit, nonpartisan organization that works across the state of Colorado to bring health and well-being in reach for everyone in our state. And that includes working with communities across Colorado to listen to them, to understand what life and their lived experience is like on the ground across the different corners of our state. And we're excited for this conversation with you all today, to circle back on earlier conversations we've been having with you about how we can listen more deeply, more intentionally to the experiences of Native American and Indigenous Coloradans. I'm going to turn it over in a moment to my colleague, Jace Woodrum, who leads our work on our annual Colorado Pulse poll. He'll walk you through what Pulse is, why we do it, and why we're excited to have this information to share with you all today. And we really hope that this is a conversation. Please consider this an informal meeting. Feel free to ask questions, offer your thoughts, either by unmuting yourself and just speaking into the Zoom or via the chat function. And you don't necessarily need to wait until after we're through showing you some of the data, what we heard from Pulse this year, but feel free to interject, to ask questions, to lift up observations, things that strike you as we go through this conversation today. And again, thank you all for joining us. We're really excited for this. And with that, I'll turn it over to Jace.
Hey everyone, good to see many of you who I've exchanged emails with, some of you who I've had the pleasure of meeting in person back when we did that. But it's great to be together virtually to share some of this data. As Kyle said, I'm Jace, I guess I should say that. And please do speak up and interrupt and ask questions and engage. I mean, for me, as I was looking through this data, again, to prepare for today, I realized how excited I am to have data from Native Americans living in Colorado and how many more questions the data creates for me. So it's like this dual feeling of satisfaction that I have some sense of answers and then a desire for more. And you may have that same experience and don't be shy about telling us like, man, I wish I knew more. I sure do. I'm going to share my screen, but I hope that doesn't make you feel like this has to be all formal and fancy. It doesn't. Share screen. All right, hopefully you're seeing my screen now, and if not, somebody just holler and say that you are not. Okay, I want to remind you first, Pulse is the Colorado Health Foundation poll. We do it every year, or at least we've done it last year and this year, and we intend to do it in 2022. It's a big part of my work at the Health Foundation and something I really enjoy talking to people about because it's really a chance for us to hold up a mirror to Coloradans and reflect back what we are told, what they tell us, what we hear, and what we see. And so I'm excited to share it with you. This is my first time presenting the data. Usually we have our pollsters do it. This time it's me, so apologies if I stumble along here. It's a lot of data. First, I just want to start by kind of telling you how we did Pulse. The whole sample is 2,493 interviews with adults in Colorado. We talk to them in the summer in English and in Spanish. And the way we do it essentially is take a list of addresses randomly. And then through data matching, we're able to find not just people's addresses, but their phone numbers and their email addresses. And so we send out postcards, emails, text messages, and phone calls, all to try to get people to talk to us. If you were taking it on the phone, it would take you about 20 minutes to answer all of the questions that we have. It's so hard to narrow down on the questions that we have in that 20 minutes. Just to give you a frame of reference, our first draft of this year's survey clocked in at 32 minutes. So that was a lot of cutting that we had to do. It's really, really difficult to decide what to include year over year. And hope that some of you have some thoughts and ideas for us as we plan for next year. This year, we did an oversample of Native Americans with the help of many of you on the line today. We had 103 interviews. Now, if you're thinking that doesn't sound like a lot, I hear you and I agree. It is more than a representative amount. So when I say representative, in case that's a sort of geek speak and sort of a nerd alert, I feel like I should give you, but because Native Americans in Colorado make up 1 to 2% of our population, that means they would make up 1 to 2% of the folks that we talk to. That would be, I'm really, really bad at math, but say 25-ish to 50-ish people. In this case, we wanted to talk to more folks so we could feel more confidence in what we heard. And so we were able to accomplish 103 interviews. We also did some oversamples with Black Coloradans and with Asian American Coloradans. All of this data exists and is available for you to geek out on and digest as you see fit, and certainly hope you will. We'll be focusing today, of course, on the Native American data. Our sample margin of sampling error for the whole sample is just under 3%. That's the sample 2,493. And we're just under 10% for the Native American sample. One more thing I'll share with regards to our methodology. One of our big goals with Pulse is to support good policy. So one of our big audiences is policymakers at the federal, state, and local level. And so to hopefully have influence with policymakers, we use a bipartisan research team. So we have a Democratic pollster and a Republican pollster who work together on the poll. And they're a great team. Any questions that you all have about how we do this? I can't see the chat, so Kyle's gonna holler if you prefer to use the chat, or you can just unmute. And I know there are a couple of folks who I just saw come in the waiting room. So if you're just catching up, feel free to unmute and just throw any questions that you have at me about how we do this poll. All right, well, hearing nothing, I'm going to continue on, but please know you can stop me at any time. Let's forge ahead. I want to start by telling you about these 103 people, so we kind of get a sense of like, who are we talking about here? So first, the pie chart shows you the counties where respondents came from, because the partner organizations who helped us conduct this poll were concentrated in Denver metro area. We were not at all surprised or concerned that our sample comes from the Denver metro area. That makes perfect sense. And this is, you can see where folks call home. Gender identity breaks up into 48% male and female, 1% non-binary, and 3% of folks who say they don't know or they refused. When you see that DK/ref, that's what that always means. We always give people the chance to say, I don't know, or I don't want to say. Ages of folks, a pretty good age breakdown. Many surveys have a really difficult time reaching young people. And often have more older folks who have landlines who we can call a little bit more easily and you don't get screened as much. But we did a really nice job with a partnership with all of you and getting younger people to complete the survey. So really happy that we had that. And you can see the parenthood piece. I wanted to pull this for you because there are a few questions that we only asked of parents. And you'll see that when we look at those, we're going to be talking about some pretty small sample sizes, right? So if we say, Native American parents with kids under 5, again, we're talking about just 15% of 103. So small sample sizes, that doesn't mean we disregard the data. All data is useful to us. I just want to lift up, some of the considerations that we want to keep in mind as we're looking at this data. And then the last thing I'll tell you about our Native American respondents is income and ideology. So pretty good income mix at the Colorado Health Foundation. We prioritize people living on low incomes and people of color. So important to us that we got a good sample size of folks who make under $50,000. Important though also to be able to compare. And so, as you can see, we had 20% of folks who make more than $150,000. I will note that it is most easy to get people who make a lot of money and have a lot of education to take our surveys. So it's not usually hard to get folks who make a lot of money. You have to work a little bit harder to get folks who make less money. So again, I'll just give some appreciation to the partner organizations who helped us get this sample. Ideologically, we see a pretty interesting split here, not an overly liberal sample, not an overly conservative sample. Thought it was kind of interesting that we had about 16% of a refusal here. Just my guess at that is how polarized we are right now politically, people desiring not to share that information, but a good mix of ideology in the sample that I think will be interesting. I'll point out some of the places where ideology may be at play. Any questions about who these people are? The 103 Native Americans living in Colorado, who they are. Any questions, any concerns? Put them in the chat and Kyle will lift them up, or just unmute and throw them at me. Okay, I'll warn you that I'm terrible at sitting in silence. So I'm going to forge ahead, but please don't hesitate. So we start the survey by asking people about their top concerns. And when we do this, we say, okay, here's a list of concerns. Do you think this is an extremely serious problem, a very serious problem, not too serious a problem, or not a problem at all in Colorado specifically? So here's what our Native American respondents said. 93% say the cost of housing is an extremely or very serious problem. Far and away at the top of the list is the cost of housing. And I want you to remember that because we asked a number of questions about housing. And so don't forget that this really tops the list by a wide margin for folks as we look through the rest of this data. Homelessness is number 2 on the list. For across, and I'll show you the comparative data, but really across all Coloradans, the cost of housing was very, very high, if not the top issue, but homelessness much further down for other populations. But number 2 for Native Americans, quite interesting. Other financial and economic concerns, high on the list, cost of healthcare, cost of living, harm to the economy due to COVID, pretty high. And then higher than many other groups, drug and alcohol use and racial bias and discrimination at 2/3. Here's another set of issues that we have here, and I want to call out that right at 2/3 of Native Americans expressed concern about the environment, air and water pollution and climate change at 65%, much higher than other groups. And I want to call this out because typically these are 2 issues that often have a partisan or an ideological lean. But as we saw when we looked at that ideological data, we do not have an overly liberal sample. Right. So what we are seeing here is that for Native Americans, the environment does not take on an ideological or a partisan lean. And instead, of course, as the original stewards of this land, the concern is high and crosses ideology, crosses partisanship in a way that isn't surprising to me. And I'm interested to hear how that lands with you all as you process and marinate on that data. Some of the other things you see here still are reaching or concerned to a majority of folks. And I want to point that out because this is different for Native Americans. They are more concerned about a number of issues than other racial and ethnic groups. So when you look at, say, our Asian American respondents, a couple of things were in the 20s for them, right? Just not a priority, just not a concern to them, or even in the 30s. But for Native Americans, the lowest thing on the list here is 46%. So everything else is a very high, half, majority, up to 93% of Native Americans saying this is a concern for me, really telling us there's a lot on the minds of our Native American respondents, a lot that they're concerned about. Questions about this? I think I may have heard somebody come off mute. Okay, I'm going to keep asking. So the next sort of set of questions is focused on financial security, and it's a pretty large group of questions that we ask to understand how people are doing financially. And we sort of come at this in 2 ways. We ask people to look back at what they have been experiencing in the last year, and we ask them to look forward, to consider what are they worried about as they look ahead. And that's one of the things I love about this survey, is that we do ask people to do both of those things. So we'll you'll look at these questions and you'll see some of them ask you to look back, some of them ask you to look forward. First, we ask folks to look back. Over the past year, how do you rate your financial status? Are you better off or worse off financially than you were a year ago, or is your financial situation about the same? We've got about 1 in 5 Native Americans report their financial status has worsened in the past year, and about half say it stayed the same. You can see the comparison data on the side here to show the different groups for whom we have been tracking really carefully, or different groups where this becomes this question becomes an issue, right? So people who are unemployed, 52% say that their financial status has worsened in the past year. People who live on low incomes, one of the stories of the pandemic has been that people who are already struggling struggled more. So we do see some of that in the data, but specifically for Native Americans, about 1 in 5 say my financial status has gotten worse. And about 4 in 10 are worried about losing their home in the next year. That is a significant jump. So here's how we frame this question. I think that's important. How worried are you that you might lose your home because you can't afford the monthly rent or mortgage? So we specifically list this as an affordability problem. Let's remember back a few slides where 93% of Native Americans said the cost of housing was an extremely or very serious concern. Now we come and we see almost 4 in 10 are worried about losing their home. That is higher than any other racial or ethnic group. It's an extremely troubling figure. Again, when we remember back to a few slides ago, when homelessness is the number 2 problem on the list of concerns, we see that sort of carrying through here in a real, I think, call to action for many of us as we consider the needs of the community. Affordable housing, really a concern here. So we've got about 1/3 of Native Americans report being worried that they will not always be able to afford enough food for their families. Again, we're asking them, consider over the next year, how worried are you that you won't be able to afford food? We've got 34% saying they're worried about affording food, kind of middle of the pack among our racial and ethnic groups here. Still 1/3, that is a concerning number, especially when you compare to all Coloradans. We've got about just under 1/4. So some significant reason to be concerned about food insecurity and hunger among the population. More than 4 in 10 are worried that someone in their household will be without health insurance coverage. 42%, really high, highest racial and ethnic group, high as the folks who we see as across all of these indicators as really struggling, people who are unemployed, people who live on low income. These numbers are right there in line with those folks. So really a concern around health insurance coverage that again, another sort of makes me want to know more. What is this about? Is this about losing coverage from employers? Is this about something else? And what's going on here? Unfortunately, a poll like this doesn't get us to ask. It's not the format where we can say, why are you worried about health insurance coverage? Tell me more. So this is one of those that certainly creates some questions for me. We also ask folks about employment as they look ahead to the next year. So we've got 17% who are worried that they might not be fully employed over the next year. Comparison data here, this isn't really an outlier in terms of some of the comparative groups that we are looking at, specifically around our racial and ethnic groups here, as Native Americans fall kind of right in the middle. So we're able to look at these numbers from 2020 and 2021. So unfortunately, I can't look specifically at the Native American numbers from 2020 because we did not do an oversample that year. Going forward, we will. So we'll be able to compare 2021 with 2022 and beyond, because we intend to do this oversample again every year. So I'm excited about that. For right now, what we can see from 2020 to 2021, when we look at the overall sample, is that financial perceptions are not materially different, which is interesting, right? Because in 2020, in the summer, when we were conducting this poll, the pandemic and the economy as a result of the pandemic in a really rough state compared to this summer. And yet we did not see materially different perceptions, really telling us that we can't blame people's financial insecurity and their struggle on the pandemic. We can't just say, we'll come out of this. We don't need to do anything extraordinary. We'll deal with it. No, in fact, people who are struggling are still struggling despite improvements in the economy. Again, another look at the whole sample. Nearly half of all Coloradans have at least one of these financial stresses. So 56% of folks said, nah, I'm good. I'm not worried about health insurance or food or housing. But then let me do that math, 44% are saying, I at least am worried about one of these. Again, we don't just ask people to look ahead, we ask them to look back. And here's some of those questions where we asked them to look back. And we didn't just ask looking back, what were you worried about? We asked looking back, what happened? What were your experiences like? And almost half of Native Americans postponed medical or dental care in the last year. And then really shockingly, because this is such a high number, 27% had to change their living arrangements because they couldn't afford the rent or the mortgage. Now, remember, we're following this through line from 93% saying the cost of housing is extremely or serious problem, 38% saying they're worried as they look ahead, they're worried in the future about not being able to pay the rent or mortgage and losing their home. And then more than a quarter here saying they've already had to change their living arrangements because they couldn't afford housing. So a major theme as we look at this data specifically for Native Americans, housing affordability, people looking at potentially not having a roof over their head, a real concern. In fact, looking at all of these hardships, Native Americans are more likely than other racial and ethnic groups to say they have experienced many of these hardships. So for postponed medical or dental care, Native Americans topping the list when compared to other racial and ethnic groups. Skip meals because you couldn't afford food. The comparison here really quite stark. 6% of white Coloradans, 16% of Native Americans saying they skipped meals because they couldn't afford food. 24% increased consumption of alcohol and other substances compared to 15% of Black Coloradans, 13% of Asian Coloradans. So some real disparity here. And I just want to hold space for what it feels like to hear about these kinds of disparities, right? We both understand the necessity of data as we try to advocate for good policy that serves community. We know that like lifting up disparities and having data that shows disparities are important, and yet they take an emotional toll on us hearing them, sitting with them, and also they don't tell the complete story of a community, right? The resilience of our Native communities in the face of historic and present day oppression and injustice, right? So I just want to create space for us to hold all of that, which is not an easy thing to do in this moment. So I'll create space for that. Ask if folks have questions, concerns, thoughts that they want to lift up before we move into our next section. I'll give you a moment. Feel free to put stuff in the chat or unmute. Okay, I'm going to forge ahead. Mental health and well-being. So when we did this survey in 2020, one of the biggest data points that came out of it was a majority of all Coloradans had experienced mental health strain. So when we were planning the 2021 survey, we thought, let's figure out what's going on there. Let's dig deeper. and understand more. So here is what we did. We asked, in the last 12 months, again, looking back, have you experienced any of the following? We asked: anxiety, difficulty focusing, excessive worrying, depression, grief or loss, and difficulty connecting with family and friends. We've got 2/3 of our Native American respondents report experiencing anxiety. And a majority have experienced many of these other things. As you can see, the majority numbers here: majority difficulty focusing, grief or loss, and excessive worrying. Just about half saying depression, and 4 in 10 difficulty connecting with family and friends. Some quite high numbers. It'll be really interesting to track over time how people report their mental health strain. If we see the numbers change as we move, continue moving through the pandemic, subsequent years, what does it look like as the pandemic doesn't play as much of a role in our lives, hopefully. So some really troubling numbers here as well. We can look here at the comparisons. Native Americans are more likely to report challenges with mental health and well-being. And almost, I think it may be every indicator here compared to white Coloradans, we are seeing higher reports of mental health strain. We wanted to understand not just what people were experiencing, but if they got some help. And we had a majority of Native Americans discuss their mental health challenges with family or with friends. Half discussed it with someone who had concerns similar to theirs. And then more than a third, 37%, spoke to a health professional. Once again, this is one of those things that makes me have more questions, right? Why didn't more folks go to a health professional? Was it couldn't afford one, couldn't find one close to you? There was a waiting list. There wasn't somebody who's culturally competent. You felt concerned about judgment or stigma you might experience, all kinds of potential reasons why people may or may not have gone to see a health professional. We didn't ask that here, but something, questions that pop up for me as I think through this data. Native Americans, 37% spoke to a health professional. That is higher than our other racial and ethnic groups. Talking with family or friends is more common across all racial and ethnic. People are more likely to speak to their family or friends compared to a health professional. Questions, comments, concerns on mental health before we move into the next section?
Hi, Jace. This is Kyle's voice, but I'm just lifting up a comment that Shauna put into the chat for anyone who's not looking at the chat box. And Shauna wrote, this validates my assumptions and what I found already in my data search as well, as you were going through the story about what we heard about mental health concerns and experiences.
Thanks, Shauna, and thanks, Kyle. I know I was getting tired of hearing my voice, so it was nice to hear yours. And please do comments like that. I would love to know what validates your own experience talking with community. We spoke with 103 people. You all talked to 103 people on the regular, I'm imagining, or you're at least talking to some number of people for more than 20 minutes like we are. So your own data collection will provide some richness to understanding the full scope of experiences and worries and priorities of the community. So please feel free to lift those up in the chat or otherwise unmute. Anything else on mental health and well-being? One thing I'll lift up, and my colleague Austin may be willing to put this in the chat. We wrote a blog post and we sent it out to our list, so some of you may have seen it, about some of the highlights from this data. Some of the big themes that we saw when we looked at this data. So I'm talking you through basically every question. But if you're ever thinking about just wanting some of the top highlights, that blog post might be an interesting thing for you to sit with or to share with others, because we really lifted up a little bit out of the weeds and looked across the stories that we heard. So thanks in advance, Austin, for sharing that. Let's move on to talk about COVID-19 vaccination. I will warn you, these numbers are out of date, right? We were in the field the end of July through mid-August. At that time, 69% of people who identified as Native American or Indigenous said they'd gotten at least one dose. Since then, we've had more eligibility. We've had organizations doing amazing work, helping people access the vaccine, helping get people answers to their questions, helping to overcome hesitancy. So thankfully, these numbers are out of date. But this is how things stacked up at the time. And then for unvaccinated folks, so if you said, yeah, I wasn't vaccinated, we followed up with, what are your plans for getting vaccinated? So I want to underline here, we are talking about a very small sample size. We're at 32 Native Americans because most of our Native American respondents had been vaccinated. So 32 people are unvaccinated group, and most of them are not planning to get a vaccine, right? So when we think about work to overcome vaccine hesitancy, a steep hill to climb here, not a lot of folks, again, only 32 people, not a lot of folks saying that, oh, I'm unsure, or we'll see, right? A lot of people saying, I've made up my mind and I'm not. That doesn't mean they're unreachable to us, it just means the work to reach them and help them get the answers that they need to inspire confidence in the vaccine. That takes a lot. And a number of organizations, including many of you on the line right now, are doing that work.
Jace, this is Tara at DIFRAC. What was the month again for the poll? The poll was in the field?
Yep, the last 4 or 5 days of July, and then the first couple weeks of August.
Okay.
Austin can put the exact dates in the chat for me since there are a few slides back. Great question, Tara. Good to hear your voice too, friend.
You're doing great. I really appreciate it.
Of course.
Yeah, and for those of you who like time blurs together and it's hard to remember what was going on in the world at that point in time, that was sort of like in the early stages of the Delta variant, like grabbing headlines and sort of the surge that we started to see towards the tail end of the summer months.
We also wanted to ask about parents, and we are, again, I'll caution a small sample size here. So we asked parents of children under 18, so we're at sample size 44. When a vaccine becomes available to your children, which of the following best describes your plan? So we've got 10% say all kids already vaccinated. That number is out of date, right? Because since then we've got opened up a whole new wave of kids to age 5. So again, numbers out of date, but what I'll lift up here is those hesitancy numbers, because what we've been seeing nationally and in some other state data is tremendous amount of hesitancy among parents about vaccinating their children. And, you know, for all of us, we made a risk-benefit analysis when we considered whether or not to get vaccinated. And for many parents, they want to talk to other parents and they want to do that sort of risk-benefit and think about, you know, what's the risk of my child getting really sick? Because they know that children don't typically get really sick, versus what are the risks, you know, long-term side effects that we don't fully understand. My wonderful colleague Joanne is on the line and has been working with me on another vaccine project where we have focused on racial equity in vaccinations. And we did, gosh, I don't even remember how many, at least 4 focus groups with Native Americans. If folks want to spend 10 minutes with me someday, I can show you a highlight reel from those conversations with Native Americans talking about vaccinations. That data is much older now. Those conversations happened in February, but they give us a sense of how people are weighing risk and benefit and what they think about as they think about that decision. So if you're like, ooh, I would love to watch 5-minute highlight reels of Native Americans in a focus group talking about vaccinations, just holler in the chat that you'd like to do that, and maybe we can get another conversation together to talk about vaccines. And Joanne, if you see a question you can answer in the chat, or you want to speak up, you are welcome to, no pressure. Anything on vaccinations before we talk about racial equity?
Jace, I will just say, I'll put my email in the chat, and if folks have questions about vaccine equity work or would like any assistance with any communications that you have going out, don't hesitate to email me and we're happy to help out with that.
Thank you, Joanne. So racial equity, I hope most of you know that as an organization, the Colorado Health Foundation exists to bring health and reach. Equity is our North Star. It's what we do. And so our challenge with Pulse, our annual poll, is how do we measure attitudes in a way that helps us advance racial equity? And I will say these are some of the questions we mull over and marinate on and draft and redraft both last year and this year, so that we are hopefully understanding more about how to bring about racial justice. So I'll walk through these, and they're a little bit complicated, so please don't hesitate to ask questions. So what we do is we ask all Coloradans to compare communities of color with white people. So and it's weird. I will just go ahead and say it's sort of weird to force that comparison. But here's how the question is. Compared to white Coloradans, do you think Indigenous or Native American Coloradans are more or less likely to experience the following? And then we ask them about a series of what we might consider unfair treatment. So do you think they're more or less likely to be treated unfairly by police? More or less likely to receive poor quality or inadequate health care? More or less likely to be treated unfairly when seeking to rent or buy a home? So we ask everybody this, all Coloradans, and here we've got about half of all Coloradans think that Native Americans are more likely to be treated unfairly, right? So those numbers come to about half across all of the issues, right? But I think what's more interesting and more telling is when we look at how Native Americans themselves answer these questions. So here's that data. We've got majorities, very, very strong majorities, saying that Indigenous or Native American Coloradans experience unfair treatment, not just among our Native American respondents, but among all Coloradans of color. And this is a chorus across, as we asked about each racial and ethnic group, Coloradans of color are more likely to say that they believe people of color experience unfair treatment compared to white people. So let's look at some of the other questions here. So we've got 6 in 10 of all Coloradans believe Black Coloradans are more likely to be treated unfairly by police. So this is interesting because we asked this in 2020 as well, and the number has stayed pretty much consistent. I was concerned that in 2020 we would have, we had around this number, 59, 60%. We were right in the middle of a summer of protests and a conversation both in our state and nationally about police brutality and violence and police killing of Black men and women, and was worried that in 2021 we'd see people's consciousness around this issue decrease. We in fact did not see that 60% still say that Black Coloradans are more likely to be treated unfairly by police. And I warned you this was going to be my chorus or my refrain here. Coloradans of color are more likely than white Coloradans to perceive that Black Coloradans disproportionately face these negative experiences. I'm saying the word Coloradans a lot, and I'm annoyed with it. So I imagine you are too. But here are the numbers. I hope they speak for themselves. We also asked about Hispanic Coloradans. Less than half think that Hispanic Coloradans are more likely to be treated unfairly in healthcare and housing, but a majority think they are treated unfairly by police compared to white Coloradans. And again, Coloradans of color are more likely to perceive that. Our Native American respondents say 60% believe Hispanic Coloradans face unfair treatment by police. Majority unfair treatment when seeking to rent or buy a home. And then this is where the chorus breaks. When we asked about Asian American Coloradans. Some of you may be familiar with the model minority myth that sort of pits communities of color, it pits communities of color against each other by talking about Asian Americans being sort of model minority, because they've achieved some pre-described version of the American dream, blah, blah, blah. It is harmful in every way, and it really shows up in the data. So again, we're looking here at all Coloradans. 30% of all Coloradans think that Asian Americans are treated unfairly by police. A quarter believe that they receive poor quality or inadequate health care. 30% unfair treatment when seeking to rent or buy a home. The dramatic differences in numbers, right? We were at a half or a majority for our other racial and ethnic groups, and a real decrease here down to less than a third or a quarter for Asian Americans. And this does carry into our communities of color. So we do break the sort of chorus here again, not as much. I think it's important to look at how Asian Americans see their own experience. So I've highlighted the Native American numbers for you here. They are more likely than white Coloradans to perceive unfair treatment against Asian Americans, but not as much as Asian Americans themselves. So I think it's really important as we look at these numbers that we consider both how a racial and ethnic group considers their own lived experiences compared to how Coloradans writ large compare and consider those experiences. Questions about this somewhat difficult set of data? Thoughts, anything in the chat of interest, Kyle? If I don't hear your voice, I'll assume not and proceed. I will say one of the great things about being able to do a survey annually is that you get to look back at what you did and think, was this interesting or helpful? And if it wasn't, you can change it. We look at every question every year to consider how helpful they were. I would love to know from this group whether or not that data set, comparing the experiences of Indigenous people with white people is a helpful way to consider racial equity and racial justice concerns. And if you have ideas of other ways to use a poll to get at those issues, we would love to hear them. That goes for across anything that we've lifted up. We want to hear your ideas and your thoughts, but this is a particularly challenging section. So I'll specifically ask for your guidance here. We're getting into the home stretch here. Just a couple more sections. Parenting and childcare. These are questions just asked of our Native American respondents who said they were parents of children under 18. So we're talking about smaller sample sizes here. But we wanted to know, have your children experienced any of the following? So 63% say their children have experienced increased mental health strain, such as anxiety, loneliness, or stress. Really high number. A third say they've struggled with school or learning. 4 in 10 say their kids have had difficulty building or maintaining friendships. Now, if you'll recall, when we asked Native American adults about their own experience, 4 in 10 had postponed medical or dental care. All of us who are parents know we take care of our kids before we take care of ourselves. So we've got 15% of kids who postponed medical or dental care, nothing to sneeze at, but not the high numbers we saw of adults. And then if you'll recall, we saw 16% of Native American adults saying they skipped meals because they couldn't afford food. That number is 6% here for children. So really small. Again, we take care of our kids before we take care of ourselves. Here's the comparison data. Native American parents are somewhat more likely to report that their children have experienced mental health strain, 63% compared to 32% of Black Coloradans, 27% of Asian Coloradans, 41% of Hispanic Coloradans. Some of the other hardships here, not a clear disparity to be seen, which I think is a good thing, right? You don't want always see disparity here, especially with such a resilient and vibrant community. So childcare, we wanted to ask questions about childcare. We didn't in our first year, but we did this year. It's been such a topic of conversation, right? The lack of affordability of childcare, just the lack of existence of childcare. The state is creating a Department of Early Childhood. Just a lot of talk about childcare as an issue at the state level, also at the federal level, with some of the bills that Congress is considering. So we did want to ask about this. Again, we've got a small sample size of 44 for this series of questions that was just posed to parents. We've got more than a quarter of Native American parents have found it more difficult to balance childcare and other responsibilities. A quarter have also been unable to find childcare for all the hours that they need it. Some lower numbers on the other pieces, 13% missed out on or declined a professional opportunity because of lack of childcare, and 19% have been unable to find childcare that is affordable. Comparison data here across the board, I'll just say that parents of color have faced more challenges related to childcare than white parents. Native Americans aren't really the driver here. If you can see comparatively, our Black respondents, our Asian respondents, and our Hispanic respondents, and even our white respondents are expressing more difficulty, more struggle, and more hardship in a number of these questions than our Native American respondents. Obviously, that raises lots of questions for me about why that is, that unfortunately the data doesn't answer for us. Not just parents of color who have faced challenges, in particular mothers of color who report the most frequent challenges. This is data from the whole set here that I wanted to just make sure you knew. Mothers of color really being squeezed by the lack of affordability and just the lack of access to childcare and the professional sacrifices that have been made, a topic well covered in the media of late. We are at our last section here about policy responses. So gather up any questions you have about childcare and parenting. I'll say we asked specifically about policies again, because one of our primary audiences are policymakers at the local, state, and federal level. We want this data to be used to craft good policy that makes people's lives better. So we lift up some policies for our respondents to consider, to tell us whether or not they support it, whether or not they oppose it. Again, we don't get to know why, but we do get to know about who, right? What can we learn from how different racial groups, different partisan affiliations, different income groups, how do these different groups think about and respond to these policies? And here's what we tested in 2021. You can see we've got vast majorities of Native Americans who support state government policies to address mental health, affordable housing, and hunger. I'll underline affordable housing again every moment along the way. So we've got 82% support for affordable, something to correct affordable housing. The policy we tested was updating laws to prioritize building more affordable housing in communities across the state. It's got the highest total support and the most intense, or among the most intense support here at 65% strong support. So that really carries through the story that we've heard of the real housing crisis being faced by many of our Native American respondents. Some of these other policies, again, have really high levels of concern. I mean, we've got basically majority support, strong support for all but one, which is at 50%. So I can't technically call it a majority, right? So 62% strong support for mental health and substance use services in communities across the state. Support for making health insurance and medical expenses more affordable, help to combat hunger, make sure people have enough food, childcare. So we asked about childcare, of course, and even though we have a lot of people who aren't parents who are respondents, we still have majority strong support for reducing the cost of childcare for working parents. Across the board, Coloradans of color are more likely to support a range of state government policies. But I will say that Native Americans are not as supported as our other communities of color. You can see other communities of color reach into the high 80s and 90s for many of these policies. Native Americans do not. Again, this makes me want to ask why, right? Is it because we don't have a great track record in Colorado of putting in helpful laws in place? Is it because of historic and present day oppression and injustice that Native American communities are experiencing? Is it distrust of government? Totally fair, right? What is it? We don't know. Maybe you have thoughts. I would love to hear them. So that was it. This was my last data point. So I'm going to stop sharing my screen and hope that we can have a bit of a conversation about what this brought up for you. What are you sitting with as you hear all of this? Thoughts, emotions, whatever comes up for you, I'd love to hear.
Sorry, I had to step away for a minute. Sean and Tracy brought over the donations from the Health Foundation for the street outreach. So thank you all for those donations, and other folks are at the SOS site helping with move-in day. So I'm here, and then yeah, somebody's with a client. So I'm here manning the door while everybody's busy. So I missed a little bit in the end there, but it really does. I'm really grateful for the Health Foundation for the sample size that you did and the outreach you did. And also this analysis is so helpful to see, because, you know, we do have some data out there, but it's really hard to find and take the time to dig through and pull those things together to tell the story that of what's going on here with the data that a lot of funders and elected officials require to take action. And so this is really validating for the work that we've done and are doing now, as in particular the housing data and the food insecurity, the mental health data, really all reflected in the work we've done in the demand and requests we've seen for the past 20 months. And really helps us tell that story to a broader audience, along with the stories we have, the qualitative data we have. So we're really appreciative of this, and I'll go back and look at the parts I missed while we had our visitors here. Thank you.
Thanks, Tara. I appreciate it. And I'm so excited we did a drive at the foundation for supplies for the Safe Outdoor site. It's been really exciting to hear about that site coming together. And I know it's been a huge lift for you and others on the line right now. So excited that it's coming up soon. And really, I think, as you said, validated by the concerns that people have, the experiences that they have, you know, right? Homelessness being the #2 concern after the cost of housing, such high numbers reporting being worried about becoming homeless. So it's always helpful when you've got some data for grant applications. We fully encourage Pulse to be used to get more people money from us or others. So use it freely for that, 100%. What else comes up for folks?
Yeah, this is Aaron from Denver Indian Health and Family Services. I just want to echo Tara's comments. I definitely appreciate all the time and effort that goes into this type of data collection and the data. And I think the sample size is good. And I'm working on some continuation and other grant applications, and I'll definitely be combing through this data. So I appreciate it just from that aspect. And seems pretty on point with, you know, a lot of other health disparity data that we see not only in Colorado but for Native Americans nationwide. But I do appreciate the data, the questions going into looking at how Coloradans, you know, look at racial inequities and injustice compared to the minority groups. I think those data points are really interesting to look at. You know, looking at how Native Americans see themselves and their life experience compared to non-natives, and, you know, not only just non-Hispanic whites, but also the other minority populations too. So I think that data is really cool, really good to see and look at. And I'm interested to see how that kind of changes and, you know, goes the next couple of years with just more education, I think, being brought about, just racial inequities and injustice, and, you know, small but big things like mascot movements and things like that, and how that's going to educate and change specifically non-native people's thinkings and perceptions and ideologies for those minority groups. So just excellent data overall. I don't have any comments or concerns or specific questions. Just appreciate all the effort that goes into it.
Thank you for that, Aaron, and Tara, for your comments as well. I just want to lift up something that Austin put into the chat a moment ago. As you talked about combing through the data, we have experimented with ways to make that easy for you and other folks to sort of navigate through what is like a lot of information. Like we ask a wide range of questions through this poll, and there's lots of different ways to look at and to sort of focus in on things that might be of interest to you, your organizations, communities that you're connected with as well. So Jace, do you mind talking a little bit about like the dashboard and all that you can find on that link that Austin put into the chat?
Absolutely. I was looking to see if I could bring it up quickly, and I probably will fumble along, but someone else, if you want to share your screen, I think Austin, you have privileges to do so, but if not, so, we have spent our fair share of time digging through data and wanted to make this more of a painless process if we could. And so we've used a tool called Tableau to, thank you, Austin, to make the data as accessible as we can. So when you go in to the dashboard, you click on one of these topic areas. Let's go to affordable housing, Austin, unless you've already clicked on something else, and that's fine. Because we've got a lag here, but all the questions focus on that issue area appear in the center. And then on the left, you can choose there are filters, and then on the right, there are filters. And so you can choose what you want to see. So all the Native American data that I shared with you, you can see yourself. Of course, I'm happy to give you this slide deck, not an issue at all, but you can see it live and in person. And then you can also look at the intersectional identities, looking at Larimer and Weld counties, or looking at only Democrats, or looking at only people who identified as gay or lesbian, or looking at people who live on low income. So you can get at that intersection of identities, knowing, and it says the number of people here, knowing that we're going to be getting into some small sample sizes, right, as we go down. So that is a reality of the data this year, and we're hoping to improve that every year. But we try to make this accessible so that people can use it. I mean, if you're getting ready to go lobby a senator, we want you to be able to pull this up and not have to call Jace and say, hey, what was that? Or you're writing a grant application and you can look at it and find it yourself. Great demo, Austin. Thank you. I wanted to ask Aaron a question about healthcare. That was one of the big disparities that we saw. Over 4 in 10 of our Native American respondents said they had postponed medical or dental care in the last year. And so I was just wondering if, as a healthcare provider, Aaron and Adrian, I see you're on too. If you saw that, if you saw a lot of people postponing care coming back, does this data align with what you saw?
Yeah. Oh, go ahead, Adrian.
Oh, no, go ahead, Aaron. I can add to it if I need.
Yeah. I haven't looked at any specific data points, but I have heard from some of our providers that was something that they noticed was that a lot of our patients were delaying care just for fear of, height of the pandemic and getting out of the house. But a lot of our patients also face other issues like transportation barriers is a big one. Some of our patients, have to take 3 light rails and then 2 buses to get here, and, things like that. So I think those common barriers were just kind of, the pandemic kind of added to those as another layer of a barrier of getting out of the house and being exposed and things like that. But one of the good things that we saw specifically for our clinic, and Adrian can probably talk to this more, but our no-show rate virtually dropped from, I want to say pre-pandemic, Adrian, correct me if I'm wrong, it was something around 30 to 40% no-show rate. And then once we went to telehealth services and went to telehealth visits, a lot more of our patients were continuing those visits and would actually show up more for their established appointments compared to prior to the pandemic. And I think that was one of the silver linings that we saw for our clinic was our no-show rate virtually went down to, I think it was like 5% or less or something like that throughout the pandemic compared to prior to, because the appointments were a lot easier to do, a 30-minute, 20-minute phone call with their provider, and compared to having to travel an hour or so or whatever it may be to get into the clinic to do an in-person patient appointment. So that was one of the really good things that we saw. So I think it does reflect, the data does reflect what we saw, but then we also saw a really good uptick in telehealth visits and our no-show rate declining.
Yeah, good. Those are all great points that Erin brought up. One of the things too is just as we were going through the survey results, I kept going back to, well, we dealt with these challenges before the pandemic. It has just really increased over the last 2 years. But also, I think in our dental clinic, we do screen everybody for COVID. In the beginning, we were testing everybody. Now that people are vaccinated, now we're doing less of the testing, but more of screening for patients that are vaccinated. But I think that, all of the different barriers that we have, they're still there. But we have, like Erin said, we have found silver linings in some of the work that is being done, like our no-show rate going down dramatically. But I think that as we move through, I know we had a meeting with the foundation a couple weeks ago. And, I think that we are still constantly in this emergency crisis situation where we're constantly adapting to the different changes, and our patients still have a lot of different needs that we can't always address. So this is great information. I really appreciate all of the effort that went into this survey. In hindsight, you kind of wish you could go back and do the survey before the pandemic to measure the results. But I think that it isn't surprising. And it is a very useful tool specific to our area. So we're happy that you're able to present this to us today.
And I said this in the chat earlier, and we really do appreciate, we couldn't have done this without the assistance of many of the folks who are on the line and your partners and contacts and community who helped us to reach out and have these conversations with Native folks who live in Colorado. So thank you for helping us to make this possible. And Adrienne, you lifted up something that we wrestle with as we think about the opportunity of us doing this survey every year going forward is, are there, questions or things that you saw in this survey where you would see some value in us asking them again? So being able to track whether or not things are changing from one year to the next in terms of what folks are experiencing, in terms of what they're actually experiencing in the last year, stuff that they're worried about going forward. Are there things that, as you saw this odyssey through the data today, that you would advise us to keep on the survey going forward? Or conversely, if there's stuff that we didn't cover in this year's survey, where if you could add a question or have us cover a different topic or ask something in a slightly different way that you would sort of lift up for us to consider as we build next year's survey, and hope to have more data to share with you around this time next year.
I always like to say it's a good start because we will always need data. And I think that we talked about this too a couple of weeks ago, that being able to start a benchmark is great. And I know that as Jace was going through the results, there were things that he even commented that we just don't have that much information. So I think that as we move forward, looking at the results again, it might be worth looking at that tool when you're building the next survey to see, hey, maybe we can expand on this area. I'd like to know why, I'd like to know more information on certain areas, especially I think that access to care is definitely a hot topic for us. It will be forever. But, as we're starting to shift our services into providing expanded services, we're discussing the opportunity of having mobile services. Those things are going to impact a survey, and we definitely want to know more about, those results in those expanded areas. But we also are talking in our clinic about, just internally of how we need to educate our patients regarding using their insurance. We just are shifted into emergency response. We're seeing a lot of breaks in people's coverage now. And so we're trying to identify ways to prevent that. We're talking about how can we expand our enrollment services to provide more education to our patients. So there's continuously information that comes out all the time, or we may be focused on one area one moment, and then we realize 6 months down the road, oh my gosh, we were doing so good over here. Now that is kind of dropped. So definitely it's an ongoing discussion, and we'd be happy to talk with you when you guys are rolling out that next survey.
Well, we will be back for the next time for this question again. So it's something that you don't have to have an answer on today, but we will start the process in January and February of writing the 2022 survey and thinking through what are the areas where we want to go deep, what are the areas where it doesn't make sense. And as I said earlier, we do want to oversample Native Americans again. And so the hope that I have is that we can continue to build out the partners who are willing to do it. We try to make it super easy, like, hey, here's a toolkit, send this out to your contacts and help us get to our goal of, a bigger sample, a more diverse sample, diversity and where people live or income or age. And I was really so grateful that we were able to do what we did this year. And that just means that the bar gets higher and higher. It's like, well, if for our first year we did so well, I guess we better set our goal even higher next year. I hope that you're able to help us again to achieve the oversample, but also to give us those thoughts on what questions to hear. Adrian, I heard you talking about coverage. We saw that show up here, a really high number of our Native American respondents saying they're worried about losing coverage. Coverage is not something we spend a lot of time on in the survey. There are other sources of data around coverage, so we've never focused on it much, but it's something that hearing you lift up the experiences at the clinic and then having it pop in this year's survey makes me think, what's going on with coverage? Is there something we need to be exploring there more specifically? So that we try to take in as much of that information as we can as we talk to people and hear their stories and say, okay, there's something going on here. So even if it doesn't prompt a question for you, hearing about what's going on as you're talking and working with community is helpful to us. I certainly don't feel the need to keep everyone longer than we have reason to be together. So I'll just see if there are other thoughts to lift up, questions, advice for us, anything you've got. Go ahead, Aaron.
The only other thing I was going to say, talking about, reviewing questions and things like that, we are working with Washington State University on a separate NIH grant that's focused on COVID vaccine and testing. And we do a whole survey. We're doing a big survey collection through that project. So what I was going to propose is I can look through that survey and maybe look at some questions that might be beneficial to add to this survey and this data collection process. So we're doing that. And then we also have another one that we're doing through a CDC grant that we have that focuses more on health and wellness, nutrition and physical activity and things like that. But I'll comb through those surveys and see if I can identify any possible questions that might benefit this survey and this data collection, not only just for Native Americans in our population, but of course for the overall survey implementation and for everybody that's going to take it. I think the one we're doing with Washington State has Something like 100 or so questions, or a little bit less than that. So it's a pretty big one. And we're doing incentives for that, so we're getting a pretty good response rate for that. So I'll look through that and see if there's any beneficial questions that I think could be added to this survey.
Yeah, thank you for that, Aaron. And in case this like inspires other ideas or curiosities for you, like one of the reasons why it was really important for us to work with organizations like yours to get to this oversample of Native Americans living in Colorado was because that there's no shortage of other data sets out there, purporting to describe Coloradans in general. But one of the things that bugs us about most others is that they don't have the sample size to be able to report data about sort of the experiences and perspectives of Native Americans living in Colorado. So if there are, topic areas like coverage, as Jace alluded to, there are other surveys, other things out there that describe the coverage landscape in Colorado. But one of the sort of weaknesses or drawbacks of many of those other data sets that do exist is that they're not able to report data specifically on Native Americans. So if there are, sort of existing surveys done by other organizations or things like that, where you like the question, but you're frustrated that there's not data for your community that's available from those surveys, feel free to send those our way as well, because that's one of the other things that we're trying to juggle in the balancing act that Chase talked about at the beginning of the call, where we have to like get this survey down to like a reasonable amount of time for a short conversation with folks that were respectful of their time when they're responding to us. Is we look at like, the data that's available out there from other sources. And when we think about the Native American communities in Colorado, the AAPI communities in Colorado, and some of those other oversamples that we did, like that's one of the things that we sort of like hold in the balance there, is that, there may be data that describes other sets of Coloradans, but not your communities as well. And so if that's one of the values that we can create through this pulse survey, we're really interested in that feedback and what could be useful to you, to the conversations that you want to have within your communities with others out there as well. So if there are other data sets where you wish that you had information about your community in them, let us know if that would be helpful for us to look at as we build next year's survey too.
Okay, thanks for that. Yeah, that sounds great.
Aaron, how are you doing that data collection? Is it primarily with clients that you have and using the incentives, or are you reaching a broader group?
Yeah, it's all through our EHR record. So they're all patients of the clinic. So in thinking through that, it would be maybe worthwhile to see, what our, this is maybe a little selfish of us to the clinic, but looking at what our patients are saying, compared to a larger Native American population throughout Colorado, because that data will be all specific to our patients and who come and visit DFIS. So it won't be really generalizable to, a greater Native American population throughout Colorado. But I think there might be some beneficial questions on there that, like I said, I can just look through that, because I really honestly haven't even had a full chance to dive through the results of that. We just did a first round the past couple months and got some data back from Washington State. So I need to comb through that and kind of see what it looks like. But there might be a handful of questions that are on there that we haven't seen through any other survey distributions like the one you guys are doing. So there might be some beneficial things on there. I just need to kind of look through it and see what's at hand.
Awesome. Thanks, Aaron. I appreciate that. We can be in touch on that. Any other closing thoughts or questions or concerns before we let you all go enjoy the rest of your afternoon? Awesome. Well, I will thank you again for what you did to make this possible. Thank you for joining for the conversation today, and know that this is hopefully for many of us, this isn't our first conversation, and I certainly don't want this to be our last. So we'll are happy to engage with you as we plan for 2022, but also digging in deeper on 2021. And want to make this as useful to you and to your work as we possibly can. So please don't hesitate to ask us for anything. So thanks, everyone. I appreciate it. Have a good rest of your day.
Thank you guys. Take care.